Welcome to our Admitted Students Week here at Massachusetts College of Pharmacy and Health Sciences University. First and foremost, congratulations on your admission to the nursing program at MCPHS. We are so excited to have you join us this evening and hope that you're able to gather information tonight to really make a more informed decision to join us. My name is Megan Lawler, and I am the Senior Assistant Director of Admission here, and I am joined with a few of my colleagues from the School of Nursing whom I'd like to have introduce themselves. Dean Gravel, why don't you go first?
Good evening. My name is Dr. Tammy Gravel. I'm the Dean and Chief Nurse Administrator for the School of Nursing, and that includes the BSN program and MSN programs.
Thanks so much. Marissa, why don't you go next?
Hi, everyone. My name is Marissa. I'm a third-year nursing student on the Boston campus.
Great, thank you. And Amanda?
My name's Amanda. I'm also a third-year nursing student on the Boston campus.
Great. Thank you all so much for being here tonight. We really appreciate you taking this time. This panel is a discussion meant to share information from Dr. Gravel and our current nursing students, really about what it's like firsthand to be a nursing student here at MCPHS. So, all right, let's get this conversation started with a question really specifically designed for Dr. Gravel. Dr. Gravel, would you be able to describe the strengths of the nursing program that makes it the best choice for students when pursuing an undergraduate nursing degree?
Sure. The School of Nursing is the third largest school of nursing or school in the university. The BSN program is delivered across 3 campuses, Boston, Worcester, and Manchester. And we also have graduate programs to include the family nurse practitioner track and psychiatric mental health nurse practitioner track. I think the strengths of the program include the commitment of the faculty and staff across all campuses to support student success and to prepare each student for the transition into professional nursing practice. The BSN curriculum is scaffolded, so your learning is a stepped approach from beginning to advance, and again, to help you prepare as a generalist practitioner as you're ready for transition into practice. I think another strength is the faculty expertise. It's vast and is focused on the learner with access to clinical experts that teach in the classroom, lab, and the clinical areas. Because we have 3 campuses, we have the opportunity to collaborate with different faculty based upon their knowledge and expertise in the profession of nursing. Another strength is student engagement. The student engagement is a priority for the School of Nursing. Students have the opportunity to participate on shared governance committees to include our undergraduate curriculum committee, student affairs, outcomes and assessment committee, and diversity, equity, and inclusion committee. Each of these opportunities impact the student's ability to gain leadership skills that are transferable into practice, And then I think one of the other pieces that are really important are clinical partners. The School of Nursing has over 900 clinical partners across New England. Not that you'll go to every one of them, of course, but it's really an opportunity to learn about the different levels of care across the continuum. The focus of our current healthcare environment is really a focus in outpatient and ambulatory care and community care and population health. And as we continue with our curriculum and looking at different clinical partners, students will have the ability to care for patients across the healthcare curriculum. And then I think the final strength that I'd want to talk about is really the resources that the School of Nursing has. And that's really evident in the resources that the students get to support their preparation for their future licensing exam, as well as our lab and simulation areas.
Great. Thank you so much for sharing your perspective on that. As a faculty member, what do you enjoy most about teaching at MCPHS?
Oh gosh, that's a wonderful question. I've been with the university for 15 years, primarily on the Worcester campus at the time, but I've taught on all programs and all campuses. I have a really strong commitment to the nursing profession, our students and our faculty. And I think one of the things that really bring me joy is seeing our students transition into practice and then come back and contribute to the School of Nursing in some way. Some of our alumni come back as faculty, as adjunct faculty. Others come back in a tutor role. Others are preceptors in the clinical environment or clinical faculty. So I think it really, is a gift for me to see this as a faculty. And it's funny, I've had students in my classroom that have said to me over the years, I'm going to come back and teach. And it's funny, they actually do. So it's really a testament to the university and their continued engagement with the school.
Great. That's such great news to hear that you've had such a positive experience working with our students and, all those wonderful experiences. So thank you. Now, Marissa, I'd love to hear a little bit from you, a student here. Could you share with us why you chose to attend MCPHS?
Yeah, so I feel like one of the main reasons I chose MCPHS is because of the accelerated program, which is done in 3 years. And then another reason would be because of the location. It's surrounded by so many great hospitals in Boston. And I was lucky enough to be placed at MGH and Boston Medical Center. So those are my two main reasons I chose that MCPHS nursing program.
Amazing. Thank you so much for sharing that. I would like to now turn it over to Amanda and see, Amanda, would you be able to share your examples of how your program has prepared you for a career in healthcare?
Sure. So I think MCPHS is a great education. I've learned so much, broadened my knowledge on so many different nursing topics that I've never even heard of that are is so new to me. I've also been at 3 major Boston hospitals for my clinical rotation. I was at Children's, Brigham and Women's, and MGH. 3 completely different hospitals, but I got so much experience at all 3 of them. And the diversity of the school is amazing. Cultural differences. I've gotten to know a lot of different people that I didn't think I would get to meet.
Great. Thank you so much for sharing those experiences. And sounds like you're really taking advantage of that Longwood medical area and academic area to, really engage in your future career. So that's really great. I'm going to turn it back over to Dean Gravel. Could you please provide us with some examples of accomplishments, appointments, and accolades for our faculty in the nursing department?
Sure. Thank you for asking. Many of our faculty within the School of Nursing are doctorally prepared, and as I mentioned earlier, are clinical experts. Many of them continue their clinical practice. Some of them continue to take students in the clinical area. But at the end of the day, as I mentioned to you earlier, they're really committed to bringing the real world experience into the classroom. Many of the faculty contribute in the area of scholarship, which advances the science of nursing. And many of the faculty also participate in outside organizations, whether they're national nursing organizations, whether they're local nursing organizations, or boards related to healthcare agencies. So again, it's a strong, committed faculty.
I know our students are being prepared for general practice on this program. However, are you able to share some examples of outcomes or paths students may pursue with a BSN?
Sure. Many of our students transition into their first level role, usually in a med-surg environment. We've had students that over the years have gone on quite a journey from med-surg all the way to med-flight nursing. One of our alumni from the Worcester campus went to Boston Medical Center right out of our program in Worcester, and she advanced her skills, and again, she's on Boston MedFlight. We've had students that advanced to the DNP role, to the family nurse practitioner role, to the psych mental health nurse practitioner role, and really are across all types of clinical agencies, whether there be outpatient or inpatient. We have students in specialty areas, maternity, or graduates in specialty areas like maternity and PD. One of our adjunct faculty is a nurse midwife, and she comes back into lab and actually guides students through the whole process of birthing and caring for infants and newborns. So it's pretty exciting on the opportunities for students as they graduate with their BSN. A handful of our students transition right from their bachelor's program right into our master's or NP program, and it's a nice continued track forward. And then there's also the opportunity to advance into a doctoral level program when that's available.
Wow, it sounds like there's no goal too big when it comes to considering this program. There's definitely a lot to consider, especially when, going to nursing school. So that's really awesome information. Thank you. Marissa, I did want to hear a little bit from you. This is a busy program, but are you able to share with us any activities that you have outside the classroom, like a volunteer experience or your clinical rotations that maybe we can share with other students?
Yeah, of course. So on campus, I am a peer mentor for the case. And then I also work at the Student Financial Service on campus. And then my last sort of activities I do for the school is I'm on the e-board for Center for Undergraduate Research. And then as for clinicals, I've been placed at Mass General Hospital, Boston Medical Center, Newton Wellesley, and Melrose Wakefield. Those have all been awesome. There's a lot of opportunities to get involved on campus. So it's important to try something new when you're here.
Amazing. Thanks so much. I'm really glad to hear that you took advantage of all of what MCPHS has to offer. So now I'd like to kind of end these conversations with just sharing some advice for students who are watching tonight. Dr. Gravel, is there any advice you can offer prospective students who are currently watching on how to be successful and really maximize their potential here at MCPHS?
Well, that's a really good question, Megan. I think the student engagement piece is really important. Get to know your peers, work collaboratively with CASE if they need some help and guidance. Work with your faculty and reach out to your faculty because they're here. And again, as I mentioned earlier, they're clinical experts and really want to help you. But we don't know if you need help if you don't reach out, right? Being an advocate for yourself, just like you'd advocate for patients in the clinical setting. I think that really translates in your experience in the School of Nursing. I did want to mention one thing with regard to clinical. Marissa and Amanda have had amazing experiences really close to the campus in Boston. However, the students can travel up to an hour radius from the campus or where they're living from because of the many challenges of getting all our students in clinical into the right experiences they need in order to meet the course and clinical objectives. They may need to travel. And again, transportation is a student requirement for the program. But I think all in all, a student coming into the School of Nursing will have an incredible experience and will have great outcomes and able to transition into the role that they'd like to have in the future.
Thank you so much, Dr. Gravel. Marissa, what perspective do you have that you can share to help our prospective students watching to be successful?
Yeah, so I guess a piece of advice I would offer is to not be afraid to ask for help. Personally, for me, going from like high school to college exam wise, I was struggling a little bit. And I was scared to ask like my professor for help in like office hours or get tutoring. So I would just say, if you're struggling, it's okay. You're not alone, and other people are in that situation too. And MCPHS offers so many resources for you to get help in your academics.
Awesome. Thank you. And finally, Amanda, what advice do you have for students who are watching this to be successful in the nursing program?
I definitely would agree. Definitely ask for help. I would also take advantage of the tutoring. I never did, and I think that it would be super helpful. I've heard very good things about the peer tutors. And time management. I think it's important to be ahead of all of your assignments because that's always a good thing to do.
Great, thank you. Thank you all for ending on such a positive note. Whether you're joining us as a freshman or a transfer student here at MCPHS's nursing program, you're in great hands, clearly. You are on your way to your dream of becoming a nurse. Dr. Gravel, Marissa, Amanda, thank you so much for joining us this evening. And as always, if you have any questions, please do not hesitate to reach out to the admissions department. We are here to assist you in your decision-making process, and we really hope to see you on campus this fall. Thank you so much.